Welcome, everybody. Allow me just a minute to put up our introduction screen here, and we'll get going with Ron and Eileen. Anyway, we are here with Senior Matters and Eileen Doherty to present on Medicare, everything that's coming up new with it for the upcoming years. Before we begin, there it is. Before we begin, I do want to go over how our Zoom webinar will be working. You are more than welcome to ask questions and make comments and communicate with our panelists today using the chat. If you have any technical difficulties, please use the chat as opposed to the Q&A so that we can get to you as soon as we can. I will be keeping an eye on the chat the whole time. If you do have questions about the content for our presenters, please use the Q&A, as this will save the questions for the end of the presentation or an appropriate time for Eileen and Ron to answer them. Finally, this is being presented in both Spanish and English. If you look down on the right at the bottom menu in your Zoom screen, you'll see a gridded globe icon. Please click on that and choose English or Spanish, your preferred language. If you are having any problems with feedback, make sure you mute your original audio. Again, if you have any problems, technical issues with Zoom, please let me know through the chat and I will get you going as soon as I can. And with all that, I will go ahead and hand it over to Ron and Eileen.
Okay, well, I'm Ron Kokish, Chair of Senior Matters. I thank Eileen from the Denver Gerontological Council for being with us today. I've heard her speak before. She knows a great deal about Medicare, and I'm sure she'll be able to answer any questions you have after her presentation. And I am also trained as a Medicare counselor. So if you have questions probably on the local level about what's available, I'd probably be the one to answer those questions. And with that, Eileen, take it away.
Okay. Good afternoon, everyone. I'm Eileen Doherty, and I am the director of the Colorado Gerontological Society, and I'm happy to be with you here this afternoon. What we're going to do is spend a little bit of time talking about Medicare, and as both of your previous presenters have indicated, if you have questions as we go through this, please feel free to ask them, and we'll see what we can do to get your questions answered. So we're going to start out this afternoon looking at Social Security. The cost of living adjustment was announced about a week ago. It will be 5.9% in 2022. You asked the question, we're talking about Medicare. Why does she care about Social Security? The increase in the cost of living adjustment for Social Security usually helps to drive the increases in the Medicare Part B premium, and sometimes it drives some of the other increases in costs as well. So that is why we always pay attention to the cost of living increase. As we start this afternoon, one of the things I want to be very clear about is that Medicare has parts, and anything that supplements Medicare has plans. Excuse me. So Medicare has 4 parts, excuse me, parts A, B, C, and D. Medicare Advantage plans, prescription drug plans, and Medicare supplements or Medigap have plans. Medicare Advantage plans are Part C, and Medicare prescription drug plans are Part D. And those are pretty straightforward because the Medicare Advantage plans will call things like Core, AARP Complete, Secure Horizons, Premier, those kinds of words. The Medicare supplements, though, get a little bit more confusing because Medicare supplements do have alphabetical names to their different plans. So there's a Medicare supplement A, B, C, D, F, G, and then I, J, K, L, M, and N, or no J, I guess it's K, L, M, N, and N. So we have all these plans that have duplicate names on the Medicare supplement side to the Medicare parts, which is original Medicare. So you just have to be really clear that you know what you're referring to when you're talking about this. So Medicare Part A is inpatient care. This basically covers hospitals, rehab, home care, and hospice. So the first couple of slides here, because we are dependent on Congress, some of the increases in Medicare have not been announced. So Medicare in Washington does not have the ability to just increase or change prices. That actually has to go through Congress. And Congress has been a little preoccupied recently with stuff other than Medicare. So as you can see, this has been delayed. The cost of Medicare is basically free for anyone who has paid 40 quarters or more of Social Security or Medicare, or if you have been married to someone for 10 years or more who has paid into Social Security. There's a few exceptions to this. For example, federal employees will have a premium to pay for Part A, and sometimes people who have not paid into Social Security will pay a premium, but it's not very frequent. This year, 2021, if you only had 30 quarters or less, you had to pay $259 a month for Medicare. And if you were married less than 30 quarters, you had to pay $471. So 30 to 39, $259, $471, less than 30 quarters. Anything over, it's free. The Medicare Part A deductible has also not been announced. You have to pay a Medicare deductible per benefit period. A benefit period is 60 days. So for example, if you go to the hospital today, which is October the 25th, and you are in the hospital for, say, congestive heart failure, and you go back to the hospital on December the 24th for congestive heart failure again, you would not have to pay the Part A deductible again. If, on the other hand, you went on December the 26th, you would have to pay a new Part A deductible. In 2021, the Part A deductible was $1,484, and that was a $776 increase from 20 to 21. So we're expecting that these numbers will be similar as well in 2022. The benefit period not only includes your inpatient hospital days, but it also includes all of your skilled nursing days. So if you go to a skilled nursing facility for rehab or to a long-term care unit in a hospital, that 60 days basically is included in that. The co-insurance, if you are in the hospital for days 1 through 60, is $0 after you pay this $1,484 this year. If you went in the hospital for days 61 through 90, the co-insurance is $371. And if you are unfortunate enough to be in the hospital 91 days or more, you have to pay $742. And at that point, you are using your 60, you can be using your 60 lifetime reserve days, and basically you have to pay all costs. Now, there are some exceptions to that depending on what kind of insurance you have. So there are 5 basic types of coverage if you have under Medicare Part A. So hospital inpatient coverage. If you are actually admitted as an inpatient, not if you are just in the emergency room, because if you are in the emergency room, that is considered an outpatient. Then there is mental health inpatient coverage as well. Again, this is in a hospital-based setting. Skilled inpatient rehab. This is where you would go for rehab following a 3-day hospital stay. Skilled home health under Part A is also a benefit. There's also a Part B skilled home health care benefit, and they have different triggers in terms of when the benefit is usable. And then the last one is hospice care. And while hospice doesn't have anything to do with hospitalization, it is a Part A benefit. So let's take a look then at the inpatient hospital requirements. So you must be admitted as an inpatient for 3 midnights to be able to take advantage of either the Part A home care benefit or the skilled rehab benefit. One of the things that happens frequently is that people are in the hospital. They have actually even been moved out of the hospital as an inpatient, or as what they believe is an outpatient. They've been moved out of an emergency room into some type of a room setting, and they assume that they have been admitted as an inpatient. The hospital emergency room has 24 hours to decide if they are going to admit you as an inpatient or as an outpatient. In order for you to be admitted as an inpatient, you must sign the MOON form, or the Medicare Outpatient Observation Notice. Medicare loves to give things acronyms in terms of names. So if somebody comes into the emergency room on hour 23 and 58 minutes and asks you to sign a form, it's most likely going to be this outpatient observation notice that basically is giving you notice that they are planning to change your status from outpatient to inpatient. Once you have been admitted as an inpatient, the other thing that the hospital is required to give you is a discharge notice, and that is called an IM, or an important notice from Medicare. And you also have to receive that copy, and you have to sign it before they can discharge it. Now, if you are in a situation where you believe that it would not be in your best interest and it would not be safe to leave the hospital at that moment or within the next few days or the next day or whatever they are proposing at the hospital, then please do not sign this notice. Once you have signed this notice, we have lost our appeal rights to be able to do what we call an expedited appeal, to be able to have you stay in the hospital longer than whatever the original projected discharge date and time is. If you are in a situation where you feel it's unsafe and you don't want to go home, ask the discharge planner if you can file an expedited appeal. And basically it goes to a third-party vendor. Their job is to look at the medical record that has been submitted and to make a determination as to whether or not you can stay longer. Usually just filing one of these will give you an additional at least 24 hours for the paperwork to go through. The maximum amount of time that you can get is 72 hours. So it's basically 3 days. And usually what I find when I have to file these is that by the end of 1 to 2 more days, the individual has become stronger and they really are safer to be able to go back home. In order for Medicare to pay for a skilled rehab stay, you have got to be in the hospital for these 3 midnights. So you have to not only be there as an inpatient, but then the second criteria is that you have to need skilled services. Skilled services are things like you need wound care, you need physical, occupational, or speech therapy, you need respiratory therapy, you need monitoring and strengthening of your limbs, those kinds of things. The costs for a skilled rehab stay are days 1 through 20 are 0, so Medicare pays 100% of those. Days 21 through 100 in 2021 are $185.50, and that's what either you have to pay or what is charged to your insurance company if you have an insurance company that pays that. After you hit day 101, basically you as the client pay 100% out of pocket. Now, sometimes what we see is that an individual will reach their day 100 and they'll be transferred into the regular part of the nursing home or the skilled facility. They will continue to get Medicare services, but they will get those as a Part B benefit rather than as a Part C or Part A benefit. The third part of Medicare Part A is home health. Again, you have to have 3-day hospital stay. The skilled services tend to be very similar to what you would get in a nursing home. And the other criteria is you have to be homebound. Medicare has its own definition of homebound, which basically means that it takes undue difficulty for you to be able to leave your home and for you to be able to get those services. Home health services have a 0 copay. So it's one of those benefits that if you need it, you should feel free to take advantage of it. Another thing that we find sometimes is that people who have been in the hospital, then they have been in a skilled rehab stay in a nursing home. Oftentimes they're not discharged with home care services. So if you find yourself in that situation, advocate with your provider to see if you could get even stronger or better if you got a couple of visits from home health. The last benefit in Part A is hospice care. And to get hospice care, you have to have a terminal diagnosis of 6 months or less. The hospice services are authorized for 60 days, then another 60 days, and then another 90 days. And hospice services, basically, we do see people sometimes get better and be discharged. We also sometimes see people who whose condition continues to deteriorate after 210 days, but does not necessarily, they've not passed away yet at that point in time. So sometimes Medicare or hospice will be extended beyond these initial 3 extensions. The hospice care services themselves, which is like the nursing services, the CNA, the volunteer, the chaplain, the doctor services, all of those come to you at no cost for the hospice services. The hospices are allowed to charge $5 per prescription for your hospice medications. And if for some reason or other you need respite care or your caregiver needs respite care, so say you go to an inpatient facility for 5 days for like a, your caregiver needs to go just, to have a little downtime, or they want to go to some family function or whatever. So the hospice would pay all but 5%, and you would have to pay 5% out of pocket. In terms of room and board, whether you're in a skilled facility or in an assisted living facility, you are responsible for 100% of the cost of room and board. This brings us then to Medicare Part B, outpatient services. So we are again working from the 2021 numbers. We do not have the 2022 numbers at this point. So this year, our Part B premium is $148.60. We expect that next year, starting January 1, it will probably be $158.50. I actually saw something on the CMS website that leads me to believe that that's the expectation of what we will have next January. Your Part B premium is usually deducted from your Social Security check if you are receiving Social Security. If you are not receiving Social Security, you will need to send a premium to Medicare every 3 months, and you will get a bill for that. We do have lots of people who take Medicare at 65 who are not employed in an agency that has a health insurance for retirees. And so they will, or does not have a health insurance for retirees. So they're carrying their own Medicare, and they will then have this COLA or this Part B premium that they have to pay because they're not getting any Social Security. So some people, most of us do not, but some people do have to pay an increased Medicare Part B and or Part D premium. The 22 numbers have not been released, but the adjusted gross amount as to when you would have to pay the increased premiums is $91,000 for a single person and $182,000 adjusted gross income. If your income for 2020 is less than that, you would not have to pay the surcharges or the additional premium. If your income is above those, then you may have to pay an additional amount over and above the basic premium for both Part B as well as Part D. Similarly, the Part B deductible for 2022 has not been released. Again, the numbers that I saw on the CMS website is that it is projected to be $217. This year, it's $203. The Medicare Part B premium is paid once a year, whereas I said on the Part A deductible, the Part B deductible is paid once a year, whereas the Part A deductible is paid every 60 days. Now, what happens a lot of times when you go to the doctor or to any other kind of provider, like a specialist or the labs or some of those kinds of things, is that the provider will ask you to sign what's called an advanced beneficiary notice of non-coverage. And the reason that healthcare providers will ask you to sign this is that if there is a procedure that is not covered by Medicare, when you sign this form, you agree to pay that cost out of pocket. And so again, if you don't want to be liable for that cost, then don't sign the notice. Now, sometimes what happens is that the providers are unwilling to provide you the care unless you sign it. So sometimes you have to sign it if you need the care or if you need the equipment or whatever. The out-of-pocket expenses for Medicare Part B are 20% of the Medicare approved charge. This is not the Medicare billed charge. This is the approved charge. And oftentimes there is significant variation in terms of what the provider will bill Medicare and what Medicare will approve. So once Medicare gives you a number as to what they are going to pay for a procedure, that 80%, then you are responsible for the 20%. Now, this is true if you are in original Medicare. If you are in a Medicare Advantage plan, it works differently. Once you are in this Medicare, once you have also figured out if what the 80% and the 20% is, then your healthcare provider has a choice. They can either accept assignment, which means that they are going to accept the payment in full of the 80% plus your 20%. If they choose not to accept assignment, they can charge you an additional 15% over and above the approved charge. So say Medicare figures that a procedure is worth $100. Say they approve $30. So Medicare will pay 80% of the 30, which is 24. 20% of the 30 is 6. If they accept assignment, basically they will get paid $36. If the doctor does not accept assignment, then they're allowed to charge an additional 15% or an additional $4.50. There are no annual limits in terms of the Part B expenses. So every time you go to the doctor, there's going to be a charge, and there's no cap on that. Most of the time, your Part B costs are going to be paid either by a Medicare supplement or, for those individuals who are very low income, by Medicaid. There's also now some providers are starting to actually give you an estimate of what the costs are going to be, both what they expect Medicare to pay, as well as what you are expected to pay. And currently there is also an app that Medicare has that you can put on your phone. This is a list of all the different Medicare Part B benefits, and it's a very busy slide. But what I wanted to really give you is I wanted you to make sure that you understand all the different services, if you will, that Medicare pays for. So they can pay for not only doctor's visits and labs and x-rays, which are the most common, but they'll pay ambulances and advanced care planning, annual wellness visits. They also now are paying telehealth. So there's just a wide variety of services that Medicare pays for. During COVID, and since we're still in the pandemic, Medicare is also paying for monoclonal antibody treatments. They're still paying for Medicaid COVID-19 testing. They're paying for antibody testing. They're paying for the vaccines. So if you are needing any type of treatment for COVID, make sure you bring your Medicare card or give them a copy of your other insurance so that they can get that billed. A couple of other things that sometimes cause a lot of confusion is immunizations. So
Otra cosa que a veces causa confusiones son las
Medicare
vacunas.
Part D pays for, so B pays for immunizations. They pay for flu, pneumonia, and hepatitis B. Any immunization or shot that you would get at your doctor's office or a community clinic or a pharmacy, they will pay 100%. Any shot that you would get at the pharmacy comes out under your Part D benefit. The primary two immunizations are shingles as well as your Tdap. Those are the two that are usually Part D benefits, and you get those at the pharmacy. I do not recommend that you get a shingles vaccine at the doctor's office because they are not a prescription drug plan provider usually, and they'll charge you full price. Even at the pharmacy, you may find that you have a fairly high copay because shingles vaccine is usually on a tier 4 or 5. And so the out-of-pocket is pretty expensive in many of the Part D plans. Not always, but many of them. So now let's switch our attention to Medicare Part C, which is the Medicare Advantage plans. There are going to be more Medicare Advantage plans available on the Western Slope this year. And as a matter of fact, for the first time, I believe there is a Medicare Advantage plan through United Healthcare going to be offered in Garfield County. So open enrollment is what we are in right now. It opens October 15th and goes through December the 7th. Open enrollment is the time when you can make any changes that you want in your Medicare Part D plan. And if you are already enrolled in a Medicare Advantage plan, you can either change within the company that you have, or you can change to another company. If you have a Medigap plan or a Medicare supplement, you do not need to do anything with that coverage during open enrollment. If you buy a Medicare supplement, you probably better plan to stay with that company for the rest of your life, because that once you get through your initial enrollment period, if you have any pre-existing conditions, you probably are not able to get a new Medicare supplement or Medigap. If you sign up for a Part D plan, or you change or make any changes in your Medicare Advantage plan, if you have one of those changes take effect January 1 of 2022. One of the things that is available through Part D is something called the Senior Savings Insulin Model. And this is basically for people who have insulin. Now, what gets confusing is that in Colorado, we have a law that says that if you are taking insulin, you do not have to pay more out of pocket than $100 per month. That works for people who are in the Affordable Care Act or the exchange. It does not work for people who are in who are Medicare beneficiaries. If you're a Medicare beneficiary, you come under the senior savings model as part of their prescription drug coverage. And the prescription drug coverage then is either included in your standalone prescription drug plan, or it can be included in your Medicare Advantage plan with prescription drug coverage. Some companies are offering some plans with basic coverage only, and that does not include the $35 per month benefit for insulin. Others are offering what we call enhanced coverage, which means that they offer 1 month of insulin at their 1 month prescription for insulin at $35 a month. Now, that works if you only need 1 vial of a specific type of insulin drug. If you need a second vial of the same drug, you will pay full price. If you have 2 different types of insulin, you can use the $35 per month charge for each type for the first vial. And then if you need more vials, then it will cost you the full price for both of them. There are 5 types of Medicare Advantage plans that I want you to be aware of. There are HMOs, PPOs, private fee-for-service, and special needs plans, and then dual special needs plans. So an HMO is the standard Medicare Advantage plan that many of us are very used to. This is the type of plan where you use the plan network providers. If you go out of the network, you're fully responsible for the cost. They usually have a formulary in their prescription drugs. They do very well at care coordination. Many of them add on additional benefits. So they may have some limited transportation benefits. They also usually do not offer comprehensive care, but they will offer some limited vision, hearing, and dental services as well. That is an especially popular add-on this year. Some of them will also add on exercise programs. So it's kind of a rich benefit package, if you will. The important thing to remember about Medicare Advantage plans is that whatever benefits that they offer over and above, in addition to the regular Medicare Part A and B services, are what they're offering this year. Next year, in 2023, they could be offering a very different set of benefits. The copays could change, the deductibles could change, the added benefits, all of those can change from year to year. In my 25 to 30 years of doing Medicare counseling, I have seen them come and I have seen them go. PPOs then are preferred provider organizations. This is the type of a Medicare Advantage plan that gives you sometimes the best of both worlds. So it will give you a network provider, and you can basically get your services when you're in the network with all of the same basic coverages and supports that you get in an HMO. But if for some reason or other you want to go outside of the network for something, you can go outside the network, and then you pay basically the 20% out-of-pocket charge of the Medicare approved charge, whatever that is. The private fee-for-service is a little bit more concerning to me. So the private fee-for-service does have a network. So again, you can get all of your services that are very similar to what you would get in the HMO. However, your provider has the ability to decide whether or not they are going to accept your Medicare Advantage plan on any given appointment. So sometimes the provider will accept it and sometimes they won't. And I just find that to be too limiting in terms of continuous coverage of care. So it's not one of my favorite options in terms of the Medicare Advantage plans. The special needs plans and the dual special needs plans, to be honest with you, I'm not 100% sure any of those are available in Garfield County or on the Western Slope. Basically, special needs plans are directed at a certain group of people. So it might be Medicaid beneficiaries. It might be people who have like heart disease, lung disease. So it's usually targeted at one particular group. The HMO gets additional dollars to provide you with additional services and additional care. The dual special needs, or the DSNPs, are available to people who are on Medicaid as well as Medicare, and they offer a very rich benefit package. If they are available, often have additional supports included. over and above like the transportation and the vision and hearing and dental. Again, their goal is really to keep people out of nursing homes or out of hospitals. So the 2022 Medicare Advantage plans that we have available in Colorado are these 10, but they are not necessarily offered in Garfield County. I'm pretty sure that United Healthcare and Humana are the two primary companies that are offering Medicare Advantage plans in Garfield County. There may be one or two others, but that's the current pretty much limitation. If you see the little cross beside the plan, basically what that denotes is that those plans are participating in that senior saver insulin model. Not every plan that they offer may be participating in that senior saver plan, but at least one of their plans that they offer is participating. This brings us then to Medicare Part D, or the prescription drug benefit. So as we said earlier, the open enrollment for prescription drugs is from October 15th through December the 7th, with coverage starting January 1, 2022. If you decide to make a change in your coverage, you can still do that on basically midnight of December 7th, but you may not get all of the enrollment cards and all of those kinds of things. Part D drug coverage then is a benefit that is offered through private health insurance plans, and we'll look at a list of those in just a moment. You can have the premium deducted from your Social Security check, or you can send a monthly premium, whatever your preference is. So Medicare Part D, the standard benefit for that, the 2022 benefit has been announced. And so the annual deductible is $480. That's $35 more than it was in 2021. Some of the standalone prescription drug plans are going to require that you pay the full $480 before you get any prescription drug coverage. Some of them will give you drugs that are on a tier 1 or a tier 2, and they may or may not hold you to the $480 number. This $480 number is the retail cost of the drugs. It is not the amount of money that you pay unless you're in the deductible. And you're paying the full $480. Once the cost of your prescriptions has reached $480, you go into what's called the initial coverage limit. Here you are required to pay 25% of the cost, or $1,107 out of the $4,430. Again, this is the retail price. So when you go to the pharmacy, that's what, if I was paying privately, that's what they would charge me. Once the cost of the prescription drugs goes to $4,430, you basically go into the coverage gap or the donut hole. And that then basically you are responsible for 25% of the cost of both generics as well as name brand drugs. There is some variation in this, but this is pretty much what it sort of ends up to be. And this $11,480 of the cost of the drugs is inclusive of the $4,430 of the cost in the initial coverage limit, as well as the $480 in the deductible. So that's a cumulative total once you get to the catastrophic coverage and you get through that donut hole and you've spent that amount of money. Then you go to catastrophic, and at that point in time, the copay varies depending on your situation. So once you are in catastrophic coverage, if you are getting generics, and the retail price of a single drug is under $79, then you'll pay $3.95 for that generic drug. Or if the retail price of that generic drug is more than $79, then you're going to pay 5% of the cost of the drug. So if the cost of the drug is $100, you're going to pay 5%. If the or $5. If the cost of the drug is $50, you're still going to pay the $3.95. On the brand name side, if the retail price of the drug is under $197, then you're going to pay $9.85, or you're going to pay 5% of the retail price over the $197. So again, it varies depending on what the pricing is. Where this becomes really important is for people who are in catastrophic coverage, and some of the pharmacies charge less for a specific drug than the pharmacy across the street. So if you're in this situation, it may benefit you to do some shopping across pharmacies to see if you can get a lower price. These are the 8 companies that are participating in the Medicare Part D plans in Colorado. So unlike the Part C plans, where they select specific zip codes as to where they are going to offer services, the Part D plans, if they come into Colorado, they have to offer services in every single county and every single zip code. So that is a real advantage, if you will, if you are doing shopping for Part D plans. We do have one plan that is exiting or leaving Colorado, and that is called Express Scripts. If any of you are in Express Scripts, you will have to select a new standalone prescription drug benefit plan, or you can use this opportunity to enroll in a Medicare Advantage plan with prescription drug coverage. Either way, we highly recommend that you go to the plan finder at medicare.gov and that you run your drugs through that plan finder to find out what makes most economic sense for you. A little bit in the way of highlights. So the Medicare Part D highlights. WellCare has the most cost-effective premium of $5.50 a month. That is probably the one that I am going to buy because I take no prescriptions. It may not be the one that I'm going to buy for my husband. I haven't actually looked yet. But this is one that is a minimal amount of money for anybody who doesn't take any prescriptions, but needs to have coverage to avoid any kind of penalties. The most expensive plan offered in Colorado this year is an AARP plan for almost $140. The average cost is $39.81 for the annual premium. And there are quite a few plans that are in that range. So when you are looking at selecting a prescription drug plan, you will want to look at the different tiers that the drugs that you are currently taking are on in terms of the prescription drugs. You get that information through the plan finder at medicare.gov. So the tier 1 plans are basically the preferred older generics, and they may cost you as low as $1 or $2. As I said earlier, oftentimes when drugs are a tier 1, the company may or may not charge you the out-of-pocket cost for the deductible. Tier 2s tend to be generic as well, but they tend to be a little more newer generic drug, Oftentimes, though, that the copays continue to still be $1 and $2. The next two are brand name drugs, and most companies have now broken this out to preferred and non-preferred. So their preferred brands are basically name brand drugs that have been out for a while, but are still under patent with the pharmaceutical company, tend to be not quite as expensive. The non-preferred brands are usually the more newer drugs that have been released more recently and tend to cost the pharmaceutical or the prescription drug plan more money. Sometimes you will see the specialty and select drugs broke out as a tier 5 and 6, and sometimes they are one and the same. These are usually very specialized drugs in the sense that it may be very few, if not maybe more than one manufacturer. They're drugs for very maybe rare diseases. And so not all of them, but some of them. And you may see your copay as high as 50% of the drug. It's also important to know that not all of the drugs are put on the same tier by all of the plans. So for example, an Aetna might have Lipitor as a tier 3 drug, but United Healthcare may have Lipitor as a tier 2 drug. The other thing when you're shopping for prescription drug plans is that there's also variation between pharmacies. So sometimes the CVS pharmacy will charge less than the Walmart will charge for a particular prescription. So it's important to note that as well. The companies or the prescription drug plans have to give you a 60-day notice if they either drop a drug from their formulary or they change tiers. It's important to know that the formulary can change every 2 weeks. And just because the company gets to change formularies every 2 weeks and they have to give you notice that they're either dropping or changing tiers does not mean that you get to get out of your tier or out of your current drug plan until 2023. So we have some resources that are available for you if you need assistance. We do have a resource packet and we can mail those to you. If you will send us an email at cogs@senioranswers.org, put your name, address, and telephone number in, we will be happy to mail you a resource packet on a wide variety of subjects, not only Medicare, but other services as well. You don't really care about Medicare on the porch unless you happen to be living in Denver. And if you do, you're certainly welcome to drive by and grab additional information and resources off of the porch. We not only have the information from the resource packet, but we have additional information there as well. So as Ron mentioned at the beginning of the session, one of the things that people find to be extremely helpful in making decisions about Medicare is the ability to do individual counseling. If you are in Garfield County or the surrounding counties around, I would highly encourage you to consider, if you want to meet with somebody in person or on the phone, to reach out to Ron. And I'm sure at the end, or he'll put it in the chat, his telephone number so that you know where to find him through the Senior Matters program. If you want to talk to someone on the phone and want additional information or whatever, you can certainly call one of our counselors at our office as well. We do have a form that you can send in, or you can give us a call. It doesn't matter. But if you send the form in, then we can get you scheduled. The kinds of things that we can help you with, as well as Ron helping you with, are general questions about coverage. It can help you about making decisions on Medicare Advantage or drug plans. If you're new to Medicare, some of the questions that you might have to figure out, if you have some special circumstances, all of those kinds of things are supports that you can ask for. If you want some specific prescription drug coverage support, we do have a relationship with the School of Pharmacy students at the University of Colorado. We only have a limited number of appointments. We have some this week and some next week, but they are supervised by faculty, and they can do drug reviews. They can do counseling on drug plans that fit your individual needs. They are doing all of those by Zoom. And if you want an appointment, make sure that you either get in touch with me or that you put a link, that you fill out the form on the link. It does ask for a list of your prescriptions, and we're happy to get those forwarded to the students with the faculty support. If you want to give us a call, here is our telephone number. We do have a toll-free number, 1-855-293-6911. We also have a Medicare counselor who is available, who can work with individuals in Spanish. And our Spanish line is 1-855-880-4777. And Marcela Gallete Fuentes is our Spanish counselor. And if you would feel more comfortable getting information in Spanish, please feel free to give her a call. And that concludes my remarks at this point in time. Here is the contact information. Colorado Gerontological Society. Our general number is 303-333-3482. And if you want to send us an email, you can do that at cogs@senioranswers.org. And our website, which has a lot of information on it related to Medicare, as well as our YouTube channel, you can access that at senioranswers.org. And with that, I will conclude my remarks.
Eileen, can you hear me?
Yes, I can.
Okay, good. Rebecca, I've got your question up there, and as soon as I finish asking Eileen a question, I will respond to yours. Eileen, while you were speaking, I looked for Humana. I'm aware of 2 Advantage plans through actually Rocky Mountain Health Services, which is a sub, they're owned by United Healthcare, but they're local, and I think they're probably better to deal with if you want an Advantage plan. I couldn't find one for Humana. When I put I don't think Humana is in Garfield County. They're on the western slope, but I don't think they're in Garfield County. Okay, thank you for clarifying. And sometimes what happens when I've done these in person is that people from outside of Garfield County tune in. So yeah, that's why I mentioned that. Okay, thank you. So do we have other questions? Okay, I would like to draw everybody's attention to RSVP. Mary Moon from RSVP is on the call, and she's just put her information into the chat. So you can feel free to call them, or you can contact Senior Matters through our email, or I put my number into the chat too. Okay, so do we have other questions? Rebecca, I believe it says here that your question has been answered live. Nope, that's from Eileen. Wait a minute, here's Rebecca. Okay, I will, it says it's been answered live, so I don't see any other questions. Alex? There's a note here that says numbers are climbing a little now as some people arrive a little late. I'm not sure what that means. Sorry, that was a note for panelists. Gotcha. Not a question, but yeah, we can give it a minute or two for any last questions to come in. Just a reminder that this session and the Spanish version of this session are recorded, and they will be available on the library's Facebook
and YouTube channels for you to share and to return to if you have any more questions. At this time, yeah, we can give it a minute or two. It looks like we have a raised hand. So we will go to Rebecca. If you'd like to post your question on the chat or on the Q&A.
Oh, okay. I don't know. I see Rebecca's question there. And the answer is the information you got is correct. If you are employed and have health insurance through your employer, you're free to keep that health insurance. It's called creditable coverage. When you finally do decide to sign up for Medicare, you will not incur any penalties because you're signing up late. You'll have all the same enrollment periods, able to sign up for an Advantage plan or a Medigap plan, drug plans. It will not cost you any more than it will cost you, if you were just turning 65 then. However, you will have to provide a letter of creditable coverage, and you probably want to check with your employer at this point. If your employer has over 20 people, I'm almost certain that you do have creditable coverage, but you probably want to check with your employer and be sure that their coverage is, through human resources or whoever issues your paycheck, and make sure that you have coverage that is creditable. It just means that it's instead of Medicare. It's just as good as Medicare, and you're free to keep it. Now, if you want to drop that and sign up for Medicare because you're better off that way, you're free to do that as well. But I wouldn't take both, because you're going to be paying for practically nothing if you have Medicare and your employer insurance. Medicare is not going to cover anything. They're going to bump everything over to your employer insurance. So
I might add to that, Ron, that some employers will pay first, and then they will require your Medicare to pay second, or sometimes they will make Medicare pay first and then they will pay secondary. So sometimes we see that variation as well. So the really most important thing is to check with your employer and make sure you know what happens when you become of Medicare age. The other thing I do want to mention is that it's probably a good idea to take Medicare Part A at age 65, even though you might not use it, because you don't want to be in a position where there's some strange rules, if you will, about signing up for Medicare Part A later. It's not usually a problem, but if you just take it at age 65, it's easier than it is to go back and try to fill in all the blanks. It's not even fix it, it's fill in all the blanks. So even if you don't use it, we always recommend just take A and then don't take B and D or C or all of that stuff if you're still employed and have coverage.
A is free, unless you don't have 40 quarters. A is free. It's not going to hurt you to have it now, even though you're never going to use it.
Right.
You will, however, when you decide to go for, just Medicare, you will have to manually fill out a paper form. As if it was today, still on paper, can't do it online. You have to fill in the form and add Part B and add a drug plan and add a Medigap policy if you want to.
Oh, you can do all that online now.
Yeah, since when?
I think maybe new this season. I'm pretty sure you can do all that online now. COVID's helped us a lot with all of that stuff.
Oh, that's great. If you can, then that takes away.
Because the Social Security offices are closed.
Yeah.
So, any other questions, Alex?
We have a question. I don't know if you've answered it already. Can you talk a little bit about the CIPC?
Sure. So the Colorado Indigent Care Program is basically a discount program offered by the state of Colorado. So this is primarily for individuals who do not have any other health insurance. So they're not eligible for whatever reason for the Affordable Care Act, Obamacare, whatever you call it, the exchange. They're not eligible for that. They don't have coverage through their employer. And so some people use CICP. When you turn 65 and are eligible for Medicare, you can continue to keep your CICP, and Medicare then becomes the primary payer, and then CICP can become your secondary or pay that 20%. Now, CICP doesn't necessarily always pay everything, and not all providers, like not all doctors and healthcare providers and hospitals and those guys take CICP. So it's not the most comprehensive coverage, but it is some coverage and it's better than none. And so if you're a Medicare beneficiary, you can get Medicare to pay 80%. You can get CICP to pay the 20% part of the time. And then CICP also does have a drug benefit, but once you take advantage of Medicare Part A and B, you do have to go into the Part D prescription drug plan. Does that answer your question, or do you have something more specific?
So probably one thing that I forgot to mention is that for Spanish speakers, we do have some people, two people at Senior Matters who are native Spanish speakers and who will translate for us if Spanish speakers need some assistance.
Great.
Okay, I have a question. Is CICP the same as Medicaid?
CICP is not the same as Medicaid. Medicaid is a state government run program that with cost sharing through the federal government. CICP is a state only program. If you have Medicaid, you will have better coverage and you should strive to get Medicaid if you can. If you can't get Medicaid, then your next option is to go to CICP.
Okay.
You also enroll for CICP at the provider. So you would get CICP like at a clinic or at, like the hospital, whereas Medicaid, you would apply for through the County Department of Human Services.
Okay, so we don't see any more questions popping up now, and we are running almost 10 minutes after. So if you can go ahead and just give out your contact information again, so any follow-up questions can be directed directly to Senior Matters or to you, Eileen. And we'll go ahead and bring this home.
Okay. So I'm Eileen Doherty, and I'm the director of the Colorado Gerontological Society. Our email is cogs@senioranswers.org. And our telephone number, our just general number, is 303-333-3482. And your local information through Ron is?
You can email me, chair@valleyseniormatters.org, then chair@valleyseniormatters.org. My cell phone is 707-496-3678. And somebody, I guess Alex just put that in the chat. When I add the phone number too, so people can get another chance to write it down. And I think there will be a recording of this session. If you have friends who missed it, we'll link to the recording on our website, valleyseniormatters.org.
Thank you. Eileen, would you repeat your email address?
cogs@senioranswers.org.
Okay, well, thank you so much, Ron. Thank you so much, Eileen, for being here with us today. Thank you, everybody who came and joined our session. Again, it will be recorded so you can revisit and share. The Garfield Public Libraries are always happy to host you. And if you have any following questions, please direct them to Eileen and Ron, and they will help you the best they can. Everybody, thank you again and have a wonderful night.
Thank you.
Good night.
Good night.